So the large part of this type of pharmacy law is prescription only prescription, the RX only prescription, or some states they say C6 or Schedule 6 controlled substance prescription, either RX only prescription or Schedule 6 controlled substance prescription. So the day supply, so no law um, talking about the quantity maybe dispensed at any single filling. So most of the insurance limit for 90-day supply. Um, for people who travel overseas or something like that, might request 6 months supply. But like I say, most insurance companies limit for 90-day supply for the prescription only medication. And then some medication, it's very dangerous to spend over 3 months supply, like over 90-day supply, medication like antidepressant or antipsychotic. Those medication, they might limit to 90-day supply maximum, like medication like Seroquel or uh, Lexapro or some medication require to monitor your blood like Coumadin or warfarin. Those medication, they may not give you more than 90-day supply. That is the patient safety, not about insurance, not about the money. That is the safety. Most of pharmacists or the doctor, they don't feel comfortable, they are not comfortable to dispense more than 95. For the refill, yeah, there's no specific or set time limitation, but many insurance companies and pharmacy systems set for 1 year. After 1 year, you probably need to get a new prescription, or the pharmacy folks, they may call your doctor office to get a prescription renewed. Partial field is permitted, and however, the total amount or quantity in all partial fillings must not exceed the total amounts prescribed per, per prescription. So when the prescriptions expire, uh, I just say valid for up to 1 year from the days were issued uh, for many insurance companies and pharmacy systems. No transfer of refill for the prescription only beyond 1 year from the day of issuance of the original prescription. So, uh, the pharmacy cannot transfer your refill to a different pharmacy if the prescription beyond 1 year. So after 1 year, most of the prescription is invalid uh, of uh, insurance companies or pharmacy system. You may ask a new pharmacy call your doctor to get a new prescription or get the prescription renewed. That's all you can do. That the old pharmacy cannot transfer your expired prescription, you know, to a new pharmacy. So this is very important information for you as a patient to understand how the pharmacy fill your prescription at local pharmacy. You know, when they get your prescription, they look at the day of the prescription were issued, and then the day supply, the prescriber or the doctor want, and then some prescription, yeah, they, like some uh, chronic disease, you might request 90-day supply, like high blood pressure or diabetes, uh, high cholesterol, those those medical conditions, it chronic medical condition, it requires you to take for a long time, then you might request 90-day supply for your convenience. And most of the pharmacists accept that request from you. Um, you don't have to ask your doctor for that. And ask the pharmacy to fill a 90-day supply as your request. And then you should know the most of the prescription is invalid or expired after 1 year. Then probably you need to get a refill before that. Otherwise, you need to have the pharmacist call your doctor office to get the prescription renewed. Some medication require you to see your doctor before they can renew. Most of the medication, within your mental health condition, like depression or anxiety or uh, the, uh, the psych the psycho problems, and and you need to see the psychiatrist before you get the prescription renewed. Or some medication require to monitor your blood, like coumadin, need to get the lab blood test draw before they can renew your prescription. Things like that. You need to work with your doctor. The pharmacy cannot help you with those things. Um, and you know, within 1 year limit, the pharmacy can transfer your refill to a new pharmacy. For example, you got prescription with 11 refills, and then the prescription after 6 months uh, of the day of insurance of the original prescription, then the pharmacist can call to a new pharmacy to get the prescription transfer. But after 1 year, they cannot do that. The prescription is no longer valid in their pharmacy system. I think most of the pharmacy set the 1 year cut off for the prescription only medication. All right, so that's all about the prescription. from C2, C3, C4, C5, and C6 prescription. And C6 prescription is the regular prescription or the RX only prescription. Each state they call different. And so um, you may have to check with your pharmacy, your local pharmacy, to see how they call the Schedule 6 controlled substance prescription. Sometimes they call the RX only prescription. Sometimes they call uh, Schedule 6 prescription or regular prescription. If you have any further question or any concern, please let me know. I'm willing to explain pharmacy law. If you confused or if you don't understand anything about pharmacy, please let me know. I want to clarify or make sure I give you the good information that can help you understand why the pharmacy give your medication, why sometimes they don't. They review your prescription. Thank you. Have a good one.